Hi everyone, this is Steph Giordano with HSRI, and welcome to the second module for the National Core Indicators Adult Consumer Survey Refresher Training. This module will walk through the pre-survey and background information sections of the consumer survey. The first part of the Adult Consumer Survey is a pre-survey form. As noted in Module 1, this is information that is used by the interviewer to help schedule the consumer survey meeting, as well as use familiar names and terms for the individual as you go through the questions. The first part of this form asks about people who may be helpful in setting up the consumer survey meeting, as well as individuals who may be involved in the meeting itself. We ask first, of course, about the person to be surveyed, their name and location. We ask whether there's a legal guardian, as well as additional contacts who may be helpful in getting information and setting up the face-to-face meeting. We also ask whether accommodations will be needed at the time of the meeting. The case manager's name, who may be able to help complete some of the background information questions, and a person who may be able to help provide information about the person's employment. We also ask who proxy respondents may be, as well as where the person lives, and this question is just to give interviewers a sense of the home if that is where the interview is going to take place. The remaining questions ask about familiar names and terms for the person to use those names and terms when you go through the survey. We ask about support staff, place of employment, program or workshop, and if there's a self-advocacy organization the person is involved with, or if there are any in the area that are well known to the individual. We also ask a few questions about self-directed supports. First, whether the person is using self-directed supports, and then if there are names that can be used in that module when asking the person about self-direction. And that takes us to the end of the pre-survey form. The next part is the background information section. The background information section begins with the survey code number. This number will be provided by the state. We also ask for region or county if this is something the state would like to collect. We then go on to ask some personal demographic questions about the person. We start with question BI3, which is new this year. We're asking for the person's zip code. While this will be entered as a numerical number, when this gets entered into the Odessa, it will change into a residential type such as urban, suburban, rural, or metropolitan. We then go on to ask about the person's date of birth and gender. Question 6 is slightly different this year. We now ask about the person's race and ethnicity in one question, and this is, as always, a check all that apply. We go on to ask about whether the person has a legal guardian or conservator. And if so, we now ask question BI8, which is what is the guardian's relationship to the individual. We ask the person's marital status, and then we have a couple of questions new this year about parenthood. We ask whether the person is a parent, and that includes a parent to adult children. And if the person has a child under 18 years old, whether that child lives with the person. The next several questions have remained largely unchanged. We ask whether the person has been diagnosed with an intellectual disability, and if so, what level of ID. It's important to note here that those questions that are highlighted in yellow are used for risk adjustment purposes in data analysis and reporting of consumer survey outcomes, and so accuracy for these questions are of particular importance. These next questions ask about other conditions that are noted in the person's record, and here we are looking for conditions that have been diagnosed by a medical practitioner. For each of these conditions, we have a no, yes, and don't know response, and ask that a response is checked off for each of the conditions listed below. Question 12A asks again what health conditions are noted in the person's record, but asks more specifically about long-term care issues such as cardiovascular disease, diabetes, and cancer. We then ask some questions about communication, what is the person's primary language, and their preferred means of communication. For this question, while we understand that a number of people will use more than one type of communication style, we are looking for the most frequently used method of communication. Then we ask about the person's mobility. We then go into questions about the person's health. We start with questions about routine care, such as whether the person has a primary care doctor or primary care practitioner, when the last complete annual physical exam took place. BI 18 asks about when the person's last dental exam took place, and here we're looking for routine dental care, not for an emergency visit to a dentist. We then ask about eye exams or vision screenings, the last hearing test, and whether the person has had a flu vaccine in the last 12 months. Questions BI 22 and 23 ask about weight and height, and this is used to calculate BMI. BI 24 asks whether the person uses nicotine or tobacco products, and this includes things such as cigarettes, e-cigarettes, and chewing tobacco. We ask of female individuals when her last Pap test screening took place, and for women over 40, when was her last mammogram. For all individuals 50 and older, we ask when was the last time the person had a colorectal cancer screening. We also ask whether the person has seizure disorders and how often. And then we go into some questions about medication use. We start with question BI 29, which asks whether the person takes medication to treat mood disorders, anxiety, and/or psychotic disorders. If so, we want to know how many medications the person is taking to treat those disorders. We then ask the same type of question for those who are taking medications for behavioral challenges. First, whether they are taking any medication, and then how many, if so. BI 31 is asked to everyone. This is whether the person has a behavioral plan, and here it may be a plan that is in place at a school, at a day program, or other facet of the person's life. We then go on to ask some questions about the person's residence. We begin by asking how long the person has lived in their current home, and then BI 33 asks how would you characterize where the person lives. This question has remained largely the same from previous years. However, we've tried to make this easier to code by adding some definitions and also putting types of settings into larger buckets, such as ICFs or other institutional settings, group homes, the person is living in their own home or apartment or with family, foster care or host home, or some other type of setting. Question BI 33 asks whether the person's residence is owned or controlled by a provider agency. And BI 34 is for those people who are living in an intermediate care facility, a specialized institutional facility, or a group home, whether that setting is publicly or privately operated. BI 35 gets at one of those HCBS regulations, whether the person is named on the lease. We also ask whether the person owns his or her own home. Question BI 37 is new this year. We ask whether the person has ever lived longer than a year in an institutional setting, such as a nursing home or ICF. For this question, we are looking for a continuous year of stay in one of those setting types. We also ask how much paid support the person receives at home. The employment and other daily activities grid again has remained largely the same from previous years. However, this year we ask question BI 39 and BI 40 separately. These ask whether the person is in a paid individual job in a community-based setting and whether the person is in a paid small group job in a community-based setting. We separated these from the request of many states who recognize that there are many individuals who work in both types of settings and want to be able to capture when the person is working in both types of jobs. We also ask about unpaid activities in a community-based setting. This can be something like volunteering. Paid work performed in a facility-based setting such as a workshop or activity center. An unpaid activity in a facility-based setting such as dehabilitation or senior programs. For each of these questions, we ask how many hours in a typical 2-week period the person is doing this activity. For activities that are paid, we ask for the total gross wages over a 2-week period, whether the person gets publicly funded services or supports to participate in the activity, and whether the job is performed primarily with a group of people with disabilities. We then go on to ask if community employment is a goal in the person's service plan. We also ask if the person is enrolled in school. This is a new question this year. For those who are in community employment, we ask some questions about their employment, whether the person receives paid time off, how long the person has been working at his or her current job, if the person is self-employed, and the type of job the person has. We then go on to ask about some other services and supports the person may receive, starting with asking which services and supports are funded by the state that the person does receive. We ask whether the person receives an ICFID or Medicaid waiver or state plan funding. We ask whether the person receives Medicare. Then we ask whether the person is self-directing, and this question is slightly different from previous years. We now capture both self-directed or participant-directed supports, so the person does not have to be on a self-directed waiver to be answering these questions. If the person is self-directing, we ask who employs the person's support workers. And the final part of the background information section is about behavioral support needs. We ask about the level of support needed, if any, for self-injurious behavior, disruptive behavior, and behavior that is destructive or harmful to others. Finally, we ask whose responsibility was to collect this background information, and this is a check all that apply. And that takes us to the end of the background information section and the end of Module 2. The next module will go on to review Section 1 of the Adult Consumer Survey. Thanks for listening.